Hi, good afternoon,
Hey, hi, good
everyone.
afternoon.
Sorry.
Welcome to the session on screening of chromosomal abnormalities and what do we do with it. We are glad to have Dr. Sheetal Sachdeva among us today to help us explore the topic. So, birth defects can damage the brain and other parts of the body. These are usually triggered by chromosomal abnormalities. And to learn more about these chromosomal abnormalities, we have to understand the screening process for them as well. So, we encourage the audience to ask the doctors any questions or doubts related to the topic. Doctor, you have the stage.
Hi, good afternoon, everyone. I'm Dr. Sheetal Sachdeva. I'm the consultant gynecologist with Apollo Prenatal, Moti Nagar, Delhi. So today we have chosen the topic of screening of chromosomal abnormalities and how do we actually do it as doctors. So first thing is that the incidence of chromosomal abnormalities is 1 in 1 is to 50 childbirths. But what exactly are the chromosomes? So, as our host has readily told you, yes, it can lead to birth defects, brain defects, spinal cord defects. But what exactly are the chromosomes? So, let us first understand that our body is made up of millions of cells, and in every cell, in the center, there is a protein. There is a protein which is called the DNA, and that DNA it harbors the information with regards to our well-being, our build. It is because of this DNA that we are similar to each other and we are different from each other as well. So this DNA is arranged in thread-like structures, which are called chromosomes. So what happens is that these chromosomes in each cell of our body, there are 23 pairs of chromosomes. So in total, 46 chromosomes are there. 23 we get from the male partner, we get from the sperm, and 23 chromosomes we get from the egg. So once the sperm and egg they fuse together, they fertilize together, the very first cell of the baby is formed, and from that very cell, the entire baby develops. So that fertilization, the procedure is very important that it should go in a smooth manner, in a good manner. So what happens is that among the chromosomes, because there are 23 pairs of chromosomes, so there's a number assigned to each pair. So 1 to 23 in certain order, and the last being the sex chromosomes, X and Y. So what happens is that while the fertilization is taking place, so sometimes there might be certain problems. There might be an extra copy in the chromosomal pair that is called a trisomy. There might be one copy which might be missing. Those are called monosomies. There might be an extra segment. There might be a segment which has been deleted, or there might be an exchange of the segments. Now, these all problems are called chromosomal abnormalities. Frankly, we don't want our baby to suffer from any of these because we have seen that many a times such babies are born with mental retardation, birth defects, limb deformities, heart defects. So we don't want our baby, for that matter, to be suffering from any of these. Now, in order to ensure that our baby is all right, we should be carrying out certain tests. But you have to remember that most of the chromosomal abnormal pregnancies are taken care of the body by itself. In nature, the rule of survival of the fittest applies. So, most of such abnormal babies, unfortunately, they are aborted by the body. Many a times, in most of the cases, in 80 to 90% of such cases, the heartbeat does not appear. There are cases of missed abortions. So that is why, when unfortunately somebody suffers from missed abortion, somebody suffers from the situation where the cardiac activity has not been appreciated on ultrasound, then we do try to console the patient that most likely there was some developmental defect in the baby, and that is why the body was not accepting it. So most of the pregnancies of chromosomal abnormal babies are aborted by the body itself. 10 to 20% will proceed into a live birth. Now we want to catch those pregnancies, and we just want to ensure that our baby is not among those 10 to 20%. So what we have done is that ideally, in order to ensure that we are not missing any abnormality, ideally we should take out the cells of the baby and do the entire DNA screening. But practically it is not possible because if we take out the cells of the baby, there is a possibility of harm to the baby, and that harm it overrides, it exceeds the benefit of doing those biopsies. So that is out of question unless and until there is certain specific condition. And the other thing is that we are not medically so advanced that we can do the entire DNA screening. It is not practically possible for us. So what we have done is that we have devised screening test. Now, what are screening test? Imagine that you go to a friend's place, you go to your parents' place, and you see a glucometer or a BP apparatus, and you just decide that let me just check my random sugar. Now you check your random sugar and it turns out to be 60, 70, 80, 90, something less than 100. So you're assured, you're like, okay, fine, I'm not suffering from diabetes, my sugars are in order, and that's the end of it. Now, in case somebody's blood sugar turns out to be 200, 250, then you just feel that you're alarmed and you feel that yes, the person should be consulting a doctor and should confirm the findings that if anything's wrong and anything needs to be taken care of. Such tests are called screening tests, but like basic screening should be done. Now, among the screening tests, there are a few ultrasounds and there are a few blood tests. Now, how do we decide the ultrasound? Well, when we do an ultrasound, then the baby is not going to wave his hand and tell us that he is not normal. So we rely on certain factors, we rely on certain basic findings which we have seen are normal in the normal babies, and they might be little variable, very different in chromosomal abnormal babies. Those markers, those findings are called soft tissue markers. So among the soft tissue markers, there is the nasal bone evaluation, there is the nuchal translucency evaluation, ductus venosus flow, and there is a set protocol for the soft tissue markers, which are to evaluate the baby. So there are two types of ultrasounds which are targeted for soft tissue markers. One is the NTNB scan, nuchal translucency nasal bone examination, that is done between 11 to 13 weeks plus 6 days. So at the end of the third month, we suggest an ultrasound NTNB and double marker. We'll come to the double marker later. So NTNB is done at the end of the third month. And in case things are in order, that's the end of it. In case there is some problem with it, so the attending doctor would be looking at other factors, the overall picture of the baby and the double marker, and would be evaluating the baby henceforth. Now, second ultrasound, which is targeted for chromosomal abnormalities, is the level 2. So level 2 is done between 18 to 22 weeks. But we try to do it before 20 weeks because we just want to do our homework prior to 20 weeks, because that gives us an assurance, and hopefully things should be fine for the baby as well. So 18 to 22 weeks is the ideal time for level 2. And in the level 2, there is a set protocol that these all things should be evaluated. So the attending radiologist would be evaluating those factors, and among those are the aneuploidy markers as well. So by level 2, by 5th month, the mini baby has formed. So there are small kidneys which have appeared, there's a small brain, there are heart. So those evaluations are done. And in case there are any red flags, those are shared by the with the gynecologist, and we take care of the rest of the evaluation. So there are two ultrasounds, NT&B and level 2. Also, there are two blood tests as well. One is again carried out at the end of the third month, and the other is carried out at the end of the 5th month. So one is the double marker or dual marker, that is done between 11 to 13 weeks, 6 days. And the other is the quadruple marker, that is done between 15 to 20 weeks. Now for the double marker, there is a sample which is taken from the maternal blood. So the mother gives the sample and certain chemicals are evaluated in that blood sample. And depending on the value, that value is compared with the healthy pregnant population of roughly the physical features of the mother, the ethnicity and all. And after that, the computer calculates and gives us the risk ratio of the most common chromosomal abnormalities. We cannot evaluate everything, but yes, the most common chromosomal evaluations are done, and the certain ratio would be mentioned in the report. It will be incorporating the ultrasound report of the NTNB as well. And after that, the final report would be the screen negative or positive, yeah, low risk, yeah, high risk. No lab can guarantee you of no risk. It will always be termed as a low risk situation or a high risk. Now, if it's low risk situation, that's absolutely fine. Then we move on to these certain evaluations at the end of the 5th month. 5th month, as I shared, ultrasound level 2 and quadruple marker. Quadruple marker, there are 4 parameters beta HCG inhibin, A unconjugated estrol, and those things are an AFP, of course, and those are evaluated in your blood. And again, among the most common chromosomal problems, evaluations are done, and the report is available as low risk or high risk. Now, more often than not, if you do these 4 tests, then there is a 95% possibility that we are not missing any major chromosomal problem. Nobody can give you a 100% guarantee. And in case there is any problem among these 4, in any of these 4, then we again do our homework, we evaluate the baby, and accordingly suggest that whether we need to confirm the findings with the amniocentesis or CVS. So this is the general basic screening, which is widely available at our Apollo Cradle Hospital also. And the second thing, which is a relative newcomer in this screening evaluation, is the NIPT, non-invasive prenatal testing. Now, what is that? It is a very useful test. What it does is that we believe that in the mother's blood, there is certain cell-free DNA of the baby as well, cell-free fetal DNA of the baby as well. So in case certain high-risk situations, or there is some problem with the dual marker or NTNP, we do suggest an NIPT test. Now, what happens is we take the sample of the maternal blood and we evaluate 5 chromosomes, 13, 18, 21, X and Y. So these 5 chromosomes are evaluated, and the good thing is the sensitivity of the NIPT is 99%. Now, there's a highly sensitive test, but then you have to understand that in case there is some problem in the NIPT, it has to be confirmed by amnio. We cannot take any step based on NIPT only. Now, the only deterrent for the NIPT could be the cost, because it ranges in certain 20 to 25,000 per NIPT result. So now these are the screening tests which are available with us, and which should be ideally offered to all pregnant ladies. In case there is any problem, as I said, amniocentesis can be done, which is a direct test to evaluate the liquid around the baby. And among those amniocentesis samples, we evaluate for the fish and the cultures. So we evaluate all the 23 pairs of chromosomes, and in case there is some problem there, then we take the matter ahead, we manage it thereafter, and in case those things are normal, we are happy and we manage the pregnancy as normal. So that will be the end of it. I hope you had a informative session, and now I would like to take up the questions, if any, or we can wrap up the session. Okay, so I hope that it was of some information to everybody, and in case you have any question or answers, please drop it in the message box. I'll try to reply it. Yes. Thank you.